You don't know who around you is essential. They might be a nurse, she a doctor, bank teller helping with deposits, flight attendants, maybe the janitor cleaning up the remnants of the school or healthcare facility, at home and nursing care workers working closer with the elderly. Their lives are as essential as what the workers do. We need them and they need you. Gas station attendants fueling cars, grocery store clerks fueling you and yours, bartenders, restaurant servers, retailers, trash disposal, keeping you fed and clean, trying to provide for their families.
Wearing a mask is the one thing that works. That and social distancing and not touching your face and hand washing, those are the most important things for controlling the virus. You're not going to get rid of the virus that way, but you'll control it.
The homeless still need shelter, and those shelters need operating. Food banks give meals to children. Starvation is debilitating. She might be a scientist looking for the cure. He might be a therapist helping you endure. Firefighters fighting more than the pandemic. Black lives matter in the streets where evil is systemic. Not to mention, black and brown people have been more affected, less resources to help their health, and already at a higher risk, asthma and higher prevalence in African Americans. Racism is still a Funeral homes are filled. People still die from other causes, but COVID is an option because we can stop this. You don't know who around you is essential. Flu season is coming and things will get worse. You won't know if the fever is seasonal or if COVID is the disease in you. A vaccine is coming, but not for some time. What we do have is a mask for your protection and mine. It's not just you. This isn't about you. If people's lives are important and is something you value, your mom, friend, or the worker that's essential, then masks are not debatable. Stop the spread, wear a mask. Together, COVID will end.
When we started in our hospital, we wore masks and all these personal protective equipment going to patients' rooms. A lot of us got infected. A lot of physicians, nurses, healthcare workers. And it turned out that they were getting infected from each other. And once we went mandated, because we're all together, we're talking about patients, we're in the rooms typing notes, but once we mandated everybody in the hospital wear masks, we eliminated that from happening. And it just shows you that the importance of wearing a mask. And we don't wear the N95 throughout the day in the hospital. We just wear a regular surgical mask, which is what people are giving out and asking people to wear, and they just don't wear it. So I can't stress the importance of wearing masks. We don't, in the hospital setting, you can't social distance as much, but on the outside you can. But even when we don't social distance in the hospital, because we're just sort of in tight quarters, wearing a mask helps tremendously.